What's up, guys? It's Q. I just want to talk to you guys today about the quadratus lumborum. It's this muscle right up in here, and it is a pain in the butt. It keeps me up at night because most injuries that you can have to your back, this muscle is going to go into a crazy spasm to kind of protect that area, and it is just miserable. You can also strain the muscle, but 9 times out of 10, it's protecting something else, usually spinal injuries or something like that you could have, and it just goes into this crazy spasm, and you'll walk around like this, pretty ridiculous, but you'll walk around and you can barely get going, and it's always just like a thorn in your flesh where you just can't move, and you look like an old man when you have it. So anyway, I'm gonna try and break down some ideas on how to release it and how to build it up and stretch it and just different things like that. Tips, tricks, and hacks. Here we go. All right, so first of all, I like to put both hands. So if I want to stretch my right side, I'll put both hands on this side. And I'm just gonna lean away and open up that right side, let my body just kind of roll with it, and I'll hold that for about 2 minutes. Just let my body hang into it. And if I want to get my left side, I can do just the opposite and get a stretch right there. Again, 2-minute holds, and that's the extra. Okay, so you can use the countertop right here. I love using this countertop. Sometimes I'm sitting at the chair and I'll just turn my back right underneath that 12th rib, okay? It's where you have that quadratus lumborum, and I'll rotate my body. I'm putting the trigger points right up in here. So you'll see that top X right in there, and I'll just kind of get right on that spot and apply pressure, and I'll move until I get the most pressure right on that spot, and I can just sit there and work that muscle and hold it for a little bit. I can kind of rock into it just a little bit and kind of work that muscle. Then I bend forward and I can go to that lower X you're gonna see in there, that trigger point spot, that common trigger point spot, and I can get right in there and I'll put pressure right on that. Maybe hold it for 2 minutes or so, just get that deep pressure and try to release that muscle. Work around and see if I can find a better spot, and that'll help release it. All right, here we go. Next thing I'll do is I'll use this is not a cross ball, but I'll use a lacrosse ball at home. I'll lay back on that spot, try to get it right into that spot, roll into it and find that hot spot. So I'll use that ball just to get in there, and then I'll go to the main spots, high and low, again in the trigger point chart, to release those spasms right in there and just try to loosen them up. And I'll lay on the floor and I'll go and just kind of find a spot, a lot of pressure on it, really get in there deep, and then relax. You can try to use a foam roller, but it's so big and wide that it really doesn't get very specific. You can also try to use Theragun, but this is kind of broad and I have a dual edge on it, so you can try that to get in there. If you're working on yourself, I guess you can use this too. All right, guys, so physical therapy is my passion, and I want to keep you guys in the game, doing it as long as you possibly can, hopefully working through injuries. Guys, so support me and like and subscribe. God bless. Bye.